Good evening, everybody. This is Dr. Patmos, and it is December 1st. I just did a video a few minutes ago about Dr. Prasad's infamous FDA memo, which was leaked the other day by the New York Times. And in that video, I referenced Dr. Tracy Beth Hoeg, whose analysis formed the basis of Dr. Prasad's memo. Uh, I felt that it would be worth a separate video to go into detail on Dr. Tracy Beth Hoeg and who she is, because this is quite fascinating. So, what I've done is some research utilizing artificial intelligence to dig into Dr. Hoeg's background and who is she and what qualifies her to opine about the COVID vaccine and myocarditis and conclude that it was the COVID vaccine that caused 10 children to die in the United States. And that analysis, which has not been published or subjected to peer review, now serves as the basis of FDA's policy going forward, which, as articulated by Dr. Prasad, will severely limit the future for vaccination in this country. So, who's Dr. Hoeg? Well, she's got a very interesting and very impressive and very unusual background. Dr. Hoeg has an MD degree from the University of Wisconsin, and she did a rotating internship, but she never did a residency following her internship or fellowship. She went instead to the University of Copenhagen, where she claims to have gotten a PhD. Now, the claims of her PhD are well noted in her CV and other um, uh, documents, but nothing from the University of Copenhagen actually says she has a PhD, though her name does appear in related articles about research done at University of Copenhagen that bears her name. It may very well be that she does have a PhD from the University of Copenhagen, but it's interesting that you cannot find any official documentation from the university listing her as a graduate with a PhD. Now, that may be just their policy. Maybe they don't publish those names, but certainly in the United States, if you want to know if somebody has a PhD, you can go to the university where they claim to have gotten one, and you can look it up and find their degree. You can't do that with University of Copenhagen. So I presume she does have a PhD, but it's not verified, at least not in the way one would expect. In addition, her PhD at University of Copenhagen was in ophthalmologic epidemiology. She did apparently do research on some issues of ophthalmology, and that was what her PhD dissertation allegedly was about. After that, she claims to have done a postdoc at a hospital in Denmark in clinical biochemistry. And again, there's some evidence that she was associated with that hospital and did some work in clinical biochemistry, but there's no official documentation of her having completed a postdoc training program in ophthalmologic epidemiology. Very impressive. Has nothing to do with COVID, however, or vaccines. So, what did Dr. Hoeg do after her training at the University of her alleged training at University of Copenhagen? She then returned to the United States, where she did a physiatry, physical medicine and rehabilitation residency at UC Davis, and from there did a fellowship in interventional pain and rehabilitation, spine and sports medicine at a private practice in Napa, California. And that's so she was working most recently as an interventional physiatrist in spine and pain medicine. Uh, Now, this clinic in Napa is a big clinic and it has some academic affiliation, and apparently it's well respected, but it is a private practice, a physiatry private practice in an area of medicine that is widely recognized to be an area where there's a lot of abusive utilization. You know, physiatrists, physical medicine and rehabilitation specialists who deal with spine and pain are very highly compensated, do a lot of invasive procedures, some of which much of which has not been well vetted in the literature and is of questionable value. And that's what her clinical practice was. Uh, well, from there, Dr. Hoeg, I guess, was a very vocal critic of COVID vaccination, and she got drawn into the Trump administration with Dr. Prasad and Dr. Makary at FDA, and she did this analysis of VAERS data, which you cannot use, but she did it anyway, that concluded that 10 children died of COVID vaccine related myocarditis. Um, the actual data analysis has not been published, and her work has not been subjected to peer review. Nevertheless, her analysis was upheld by Dr. Prasad, or held up by Dr. Prasad, as definitive, conclusive evidence that at least 10 children and probably more died from the COVID vaccine, and therefore, going forward, the FDA is going to severely limit future vaccine development and oversight regulation. Not limit oversight, they're going to actually increase oversight and increase regulation and limit future vaccine development. And it's just fascinating to me that Dr. Hoeg it's her work that this FDA policy and Prasad memo is based on, and her credentials are very, very interesting and very unusual, going from an MD degree to a PhD in on ophthalmologic epidemiology to clinical biochemistry to physiatry and pain medicine, and now an expert in vaccines and in analysis of vaccine related injuries, none of which has been published or peer reviewed. What's missing in her background that would really lend credibility? She has no training in infectious diseases, none. She has no training in internal medicine, no fellowship in infectious diseases. She has no background in vaccine development, vaccine analysis, microbiology, or immunology. She's a pain specialist, a physiatrist. She's really out of her area of expertise doing this kind of analysis and research. Yes, she has allegedly a PhD in epidemiology, but it was not in anything related to infectious diseases or vaccines. It was related to ophthalmology. So this is a typical thing we see throughout the Trump administration and the physicians that are in these positions of power. They have either grossly inflated, exaggerated credentials, as some in the administration have, and others are a complete mismatch. So we have Dr. Bhattacharya, who is an MD, but no graduate medical education, and is an economist running the NIH. We have Robert Kennedy, who's a lawyer, running the Health and Human Services. We've got Dr. Oz, who's a surgeon, running CMS. We've got Dr. Makary, who's a surgeon, running FDA. He's Prasad's boss. We have Prasad, who's an oncologist, now telling infectious disease doctors what to do. We've got Dr. Malone, who's a GP with 1 year of pathology internship, and that's all, sitting on the CDC ACIP, dictating to us about vaccines and mRNA vaccines because he did some research on mRNA when he was a medical student. So we have throughout the whole administration. Oh, the latest, Dr. Abraham, who is an MD with a 1 year internship who practiced in rural Louisiana for 30 years, now second in command at CDC. What we have are people with sometimes inflated and exaggerated credentials, even fabricated credentials, people with very low level academic credentials, and people with completely mismatched credentials. Dr. Prasad is an oncologist. He's qualified to deal with oncology. He's not qualified to deal with infectious diseases. I'm sure he wouldn't appreciate an infectious disease doctor dictating to oncologists how they're supposed to practice. Yet we have an oncologist now dictating to infectious disease doctors about how they're supposed to practice. I think Dr. Hoeg's credentials need further verification. I would love to see public proof that she does have a PhD, in fact, from the University of Copenhagen, not just her claims of that. I think it's incumbent upon her to present an actual degree, and for the University of Copenhagen to confirm that she does have this credential. That would be appreciated. I think also her research has to be subjected to peer review, because it has really been uh, held as a great vindication for the anti-vax movement that the FDA is now finally admitting that children died of the COVID vaccine. Coming from VAERS data, you can't draw that conclusion. So I think this has really been a misuse of VAERS data, and her research needs to be subjected to peer review immediately. Thank you for your attention to this request, as someone likes to say these days.